Hey everyone, I'm just here doing a video. I've tried to make this so many times, but I'm gonna do it now. But I just wanted to do this video about ovulation induction and just talk a bit more about it, what it involves, and side effects, and all that sort of stuff that I've been informed about before trying. So yeah, I stayed up a bit last night and I finally went through all the notes in the bag that the nurse gave me, because I really hadn't even had a chance to, so I finally went through all the stuff last night, so I thought I'd talk a bit about it. So first of all, what is ovulation induction? So it just says here, I hope you can hear me as well. Once you have established that there is an ovulation problem, your doctor will discuss with you a number of treatments that can be used to restore fertility. In other words, to start you ovulating again. So for women that don't ovulate or ovulate irregularly. The term ovulation induction, OI, which I found out last night, is a shortening of it. So if you hear me say OI in more videos, that's obviously what I'm referring to. So yeah, the term OI refers to the use of medical therapy to help you grow and ovulate an egg when you do not normally ovulate. Ovulation induction involves taking fertility drugs either in a form of oral tablets, which I'm not taking, or injections to stimulate the release of follicle-stimulating hormones, FSH. Only a small dose of hormone treatment may be needed to develop the follicle. The medications are taken at the beginning of the menstrual cycle. Throughout your cycle, you will be monitored with blood tests to measure the levels of estrogen and ultrasound tests to determine when you are ovulating. This will help you decide the best time for intercourse to achieve conception. Based on these results, your doctor will also be able to adjust the dose of treatment and individualize the treatment to suit you. So it's just got here, like, this is just what I'm reading off. So it's just got in that green box there, day 1 of your period, so you get your period. Day 4 you start taking medication. Day 10 or 11 blood tests to determine hormone levels. Day 14 ultrasound to determine ovulation. So that's what it says in here. This book is all about it, so I could go on forever, but I thought I would just talk about what it is and what it does basically. So starting a cycle of OI. So to commence the cycle, I telephone the fertility centre on day 1 of my cycle, i.e. the day that you first wake up with menstrual bleeding or begin bleeding before noon. If you start bleeding after noon, so like 12, then the next day is regarded as day 1. If your period commences during the weekend, please phone and leave a message and present for a blood test between 7 AM and 9 AM on Monday morning. So obviously that's because they're not open on the weekend, so you have to do it on the Monday. And then on day 2, you will have a blood test to ensure that the hormones, is it estradiol? I don't know if I can pronounce it. This word here, just next to my finger. I think it's estradiol, that one. Progesterone and LH are baseline. Consent forms will need to be signed on both partners. Through this consent can be withdrawn at any time. Yes, yep, blah, 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 blah. So, injections and monitoring. So, FSH, the follicle-stimulating hormone injections, will commence on day 3 to 4 of your cycle and are given daily until ovulation. A blood test will be done on approximately day 9 or as organised to assess the effects of the FSH in stimulating the ovaries. The results will then be available in the afternoon when instructions on how to proceed will be given. So obviously, yeah, you just keep doing it until you basically ovulate, until they tell you to stop, basically. An ultrasound scan will be performed as you approach ovulation. This is a transvaginal scan, so a full bladder is not necessary. The scan measures the thickness and quality of the uterus, the lining of the uterus, endometrium, and the diameter of the growing follicles. When all the tests indicate that ovulation is about to happen, an injection of Pregnal or Overdrill, which I'm doing Pregnal, will be given to trigger ovulation. Sexual intercourse should then be had over the next 2 to 3 days. And it says once the HCG injection has been given to trigger ovulation, smaller doses will need to be given every 3 days on 4 occasions. And that just says alternately, progesterone pessaries may be used in women for whom the supporting HCG injections are not advisable. Which I probably won't have to do. And then blood tests, these will be performed approximately 7 days and 16 days after ovulation. The first blood test checks that ovulation occurred, and the second blood test is a pregnancy blood test. And it just says if more than 3 follicles develop in the cycle, that are obviously quite large, we may not be able to continue the treatment because of the risk of multiple pregnancies. And also, that's it. So I also thought it was good too, because the clinic actually offers free counselling, so I think that's really good. Obviously, if it gets hard and stressful, oh, my back's hurting sitting here, you know, you can have free counselling, which I think is amazing. It's really good to have that. So I don't know if I'll need it, but you know, I think it's really good that they have it there. So that's what I'll be doing through the cycle. Obviously, I hope that explains it a bit better from my other video. I did say that I didn't want to start until I wanted to skip a cycle and do the acupuncture and take the natural herbs and just see how we go until we do an OI, but I don't know. I really feel like I just want to get into it straight away. But I don't know, it's something I have to really think about and decide. I don't even think we'll have time though, because if AF arrives soon, we need to do more bloods, and he needs to do a semen analysis, so I don't think they'll get there in time. Like, that has to be handed in before we start the OI, so we probably will have to skip a cycle anyway. But yeah, I suppose I'll show you. So the 2 different injections I'm using, one is gonal pen and the other is Pregnal. So I'm taking Pregnal 1500 and Pregnal 5000. So this is just a bit about it. I won't read it obviously, but that's a bit about it. Obviously, if you want to read it, you can pause and zoom in or whatever. But that's the 1500 Pregnal. So this is the one that I use in like the second half of my cycle. I'm pretty sure. I'm not sure now. I think the gonal is the one that I use at the start. I can't remember. And that's the 5000 Pregnal. So yeah, I hope you can see that. And then the gonal. So they give me a DVD, which is really cool about this one. That's just a bit about it as well. And then it just does the injection. So this is the pre-filled one, and I just dial it to how many units I'm using and just keep it in the refrigerator. I think they all belong in the refrigerator. So yeah, that's it guys. This is just a little video about OI, and obviously yeah, I thought I'd make a video anyway. I wasn't sure if anyone else out there maybe is going to start something like this or whatever, so I thought I'd do it. and at least it lets all you girls know to like understand a bit more what I'll be going through. So when you see updates and blah blah blah, I guess you will sort of understand, because it's going to be quite busy through the cycle, I would imagine. But yeah, that's about it. I better cut you off short. And today I'm CD26 and not feeling any different. How many days past ovulation am I? 5? 5 or 4? 5 or 4 DPO, so just getting some acne now, which is usually a sign that AF is close, so I'm just not going to really think about pregnancy. So anyway, I better go. I hope you guys liked that video, and if you had any more questions or anything, just comment below. I'll be happy to answer them. So I will speak to you guys soon. Bye. Take care, everyone, and thinking of you all, sending wishes to everyone who's trying. So bye.